Pain psychology, I'm a clinical psychologist by practice, and I've specialized in pain psychology for quite some time now. And essentially what it is working with the personal side of what people are going through medically. You know, it's a huge understatement to say that, you know, oftentimes when people go through a life-changing injury or illness or circumstances, not only does it affect us medically, and there's work to be done either by the surgeons or the physicians or the rehabilitation specialists, but also by the psychologists in particular to address things like illness-related depression or anxiety, forms of emotional distress, or just regular kinds of stress that will come about as a consequence of the ordeals of what they're going through medically. Things such as maybe lost time from work, or the inability to function in a way that a person had been used to, either because of pain or physical limitations. And it affects things from our self-esteem to sleep issues to all sorts of identity-related matters that now come into play that weren't there before somebody experienced this kind of a physical insult into their lives. Well, the majority of folks that I see there are there with some kind of pain-related problem, orthopedics of course, either because of an injury or a gradual onset from wear and tear over many years. I also see people who have been in motor vehicle accidents, other kinds of industrial or work-related injuries, where because of what they're going through, it really has turned their lives upside down. And so a big part of what I do with folks is help them to develop coping skills to cope with what we call the biopsychosocial challenges, or really cope with the medical challenges, the psychological, the interpersonal, the situational, that essentially a lot of people have not had the experience or training to meet the demands of their situation. So oftentimes people so unfairly mislabel themselves as not being strong enough or not having the resilience or intestinal fortitude, when in fact there's a whole host of skills out there and training mechanisms that can help people cope more effectively. So oftentimes people who are struggling on the personal side of what they're going through medically, it's mostly because of what we would call coping skills deficits. And these, in session, these are things that we can train people on, educate them on, practice, so that essentially, even if they are not eliminating pain, they're able to cope more effectively with not only pain in their lives, but some of the other kinds of challenges that go along with it. Essentially we're wanting to help people, or from my world, to help people live with pain being a part of their lives, but not having pain be the dominating part of their lives. Age-wise, I work with adolescents. I think the youngest person I'd seen was maybe 10 or 11, up to people in their 90s. And unfortunately, chronic pain doesn't really discriminate in terms of age, and that's the majority of the folks that I will see. I also see folks who are coming on board for weight management issues. There again is another great example of the interdisciplinary team approach, that the majority of people who know they need to lose weight basically have not been given the coping skills or the program to help teach them how to do it successfully. Oftentimes people are told, well, you're morbidly obese, you need to lose weight. Tell me something I don't know. But to then have the doc say, let me refer you to Dr. Kalisch, and in working with him, you can acquire the skills and the information necessary to be successful, in losing the weight. And a lot of the people that I see need to lose weight before they can go on to have some of the surgeries, because our docs truly believe that in many cases, being able to lose some weight pre-surgically gives you a much better post-surgical outcome. So there again, it's wonderful to be on site and have all the different professionals interacting and communicating under one roof. I guess just the convenience really makes it a lot more doable. Well, I've been there I think for about 6 years, and before that I was working in Chicago at Northwestern Memorial Hospital, and then I came out here originally from the University of Vermont. And I've been really lucky, I think, in each setting to come on board to an established culture where people had a mutual respect for each other and a true sense of camaraderie and teamsmanship. And also, I think in each case, the caliber of medicine has been just phenomenal. So I think I attribute that a lot to the organization and the culture that's already embedded there, and that they bring on probably people who will fit in well with that culture, people who just by their nature will want to be collaborative, will want to excel at what they do, not only clinically but passionately as well.